I'd just like to say again, I'm really thrilled to be invited to talk about ectopic pregnancy. It's really a subject that is very dear to my heart and I'm very passionate about. And I, through my own experience and through the women that I work with and the women I support as well, I really find actually that this is an area that within the fertility community that really isn't covered very often, and people can feel very isolated and fearful around ectopic pregnancy. So just want to, oh gosh, sorry, hang on. Right, sorry everybody, I'm going to try one more time, see if that's okay. Right, that's okay. What we're going to cover today is, as Abby said, I'd want to just tell you a little bit about my story. We're just going to cover the sort of the fundamentals of what an ectopic pregnancy is. What are the risk factors for an ectopic pregnancy? Because a lot of women actually don't really understand why they might have had an ectopic. And, you know, there are no definitive causes of ectopic pregnancy, but there are lots of things that can be a factor. And really the question that I get asked an awful lot is there anything that we can do to reduce our risk? And what can we actually do to improve our chances of having successful pregnancy? And how can we actually move on from this sense of fear and sort of getting ready to try again? So I'd just like to introduce myself. My name is Victoria Smith. As Abby said, I'm a nutritional therapist and I do specialise in this area, particularly in ectopic pregnancy and IVF preparation. I use a functional medicine approach, which means that I like to work to try and uncover the root causes of what might be going on with people. And why am I really interested in this area is primarily because I have been through both ectopic pregnancy and IVF myself. My fertility journey was a real roller coaster and lasted for 7 years. And we found it very difficult to get pregnant naturally. When I was able to get pregnant naturally, unfortunately, both times ended in ectopic pregnancy. So it was a very, particularly the first time was a very distressing, very devastating experience, which came as a complete shock out of nowhere, really. And the whole experience really turned my life upside down. And in my previous life, I was a vet, and I then was so, you know, found the whole experience so influential in my life that actually I decided to retrain as a nutritional therapist, because I wanted to help other women and couples that had been through the same experience. So we were, as I said, we were lucky enough to be successful with IVF twice. So I also do a lot of IVF preparation with my own clients, and also I do some work with a fertility clinic called IVF Matters as well. Okay, so just going on to some of the fundamentals, which I'm sure, I'm assuming that probably most of the people either on today or coming to listen to the replay, you know, will either have had an ectopic pregnancy themselves or perhaps have known somebody that has had one. And let's just sort of go back to basics here, that fertilization should actually take place in the fallopian tube. So the number one function of the tube, of the fallopian tubes, is to transport the egg from the ovary at ovulation, and it sort of travels around the tube, and then if the sperm meets the egg and it fertilizes, then the fertilized embryo then carries on down the fallopian tube into the uterus for implantation in the endometrium, which is the lining of the uterus. However, what can happen is that you can have a number of errors to this process, and most often it is associated with some sort of pathology in the fallopian tube. So something that has caused, you know, an infection, or there's some scarring, or there's some damage somehow that stops that free movement of the fertilized egg. and unfortunately implants in the wrong place. Now, what we've got here is just a picture of all the different sites where ectopic pregnancy can happen. Most common is somewhere in the fallopian tube. Sadly, the pregnancy is never viable and is potentially life-threatening to the mother. And it's estimated that about 1 in 80 pregnancies are ectopic. And in the UK, this is around 11,000 pregnancies a year. So actually, it is a considerable number, really. Many women are left traumatized by the experience, particularly if they've had to go for surgery. You know, it can happen very quickly. It can be a very frightening experience. They often will you know, in some cases will have lost, you know, will have ruptured, and it's a medical emergency at that point. And it's estimated that about half of the ectopic pregnancy seem to be caused by some sort of damage to the fallopian tubes, whether that's by infection or previous surgery and scarring and things. So that does leave a large number of ectopic pregnancies that aren't caused by this. And we're going to go on to just thinking about what might be behind that. Okay. So the symptoms of ectopic pregnancy sometimes can be quite confusing, because some women may not know that they're having an ectopic pregnancy. They may know that they're pregnant. They may think everything's absolutely fine, and it's only at an early scan that they might have any indication. For women who do have symptoms, these tend to develop between around sort of early from sort of the 4th or 5th week onwards, up until sort of the 8th, 9th, 10th. Sometimes I have heard of women who don't know that they're having an ectopic until, you know, sort of the 11th or 12th week, which is obviously quite late. Symptoms can obviously include, so, you know, obviously a missed period, other sort of more general early pregnancy signs as well. So you can just think that everything's absolutely fine. That was what happened in my case. Then it's only sort of later on that you might start getting sort of pain low down in the tummy, particularly on one side. That can be a sort of a warning sign. It doesn't necessarily have to be on one side, but just sort of keeping an eye on that. Vaginal bleeding and or a sort of a brown discharge is quite common as well. Sometimes you can get pain in the tip of your shoulder, or it can just be a general sort of discomfort when needing to sort of urinate or passing a bowel movement. So if you are pregnant and you have any of these symptoms, then it's definitely worth going to see your GP and getting just sort of having a conversation with them about that. However, it can then move on to a more serious stage, and really the advice is to go to A&E immediately if you are pregnant and you start sort of getting the following symptoms: that you have a very sharp or sudden intense pain in your tummy, you suddenly start feeling very sick, very dizzy, or you start fainting, looking very pale. And, you know, this is basically a sign that it could be a possible rupture of the fallopian tube. Obviously, this needs to be repaired as quickly as possible. And if that is left, it can be life-threatening. So I think the important thing to remember is that some women are having symptoms, others may not. It may just be a sort of a very vague pregnancy, you know, early pregnancy symptoms. So if you are concerned, then please seek medical help. Okay. And then what are the treatment options? And there are 3 options. And the first one is expectant management. And this is actually, you know, this is really just a small number of women that they will actually receive this sort of treatment. And essentially, this is where actually you're just left and you're monitored. And if you are very low risk, it's the doctors will actually monitor you very, very carefully to see whether the body will actually naturally resorb and absorb the pregnancy. So you don't then have any sort of medical or surgical intervention. It's just a watching and waiting and you know, continual sort of blood testing as well to make sure that your HCG levels are going in the right direction and are low to start with. Really, this is only used for women who are very, very low risk of rupture. The second, which, you know, some of you may have had, is a methotrexate or multiple methotrexate injections. You know, one may not be enough. And this is basically a type of, it's like an anti-cancer drug basically, and it interferes with the folate metabolism of dividing cells. So essentially it just stops the pregnancy from progressing. But you may need more than one injection, and it doesn't always work. So there are women that will have, you know, one, if not two injections. Then they're deemed that the HCG levels, which is the pregnancy hormone, is still rising, indicating that the pregnancy is still growing, and they then need to be transferred for surgical management as well. So it can be quite a drawn out and lengthy process. And I think this often can be very distressing for women to have to go for repeated blood tests and monitoring and medical management as well. I think it's important to really think that, to note that if you do have a methotrexate injection, even just one, and even if you then go on to have surgical management, you really must wait at least 3 months before trying again, just because obviously the medication interferes with dividing cells and could be harmful if you then had got pregnant again. You know, even if that pregnancy was in the right place, that would be a risk factor for that pregnancy. So third one is obviously surgical management, and this is carried out by keyhole surgery under general anaesthetic, and unfortunately, obviously, the embryo is removed, and often, not always, but usually the affected fallopian tube will be removed as well. Okay, so going on to the risk factors for an ectopic pregnancy, and I think this is a really important sort of question, really. What are they? Because as I said, a lot of women really don't have any real clue about why they might have had an ectopic. You know, what are the reasons? And I think that can be quite an isolating experience, just not quite knowing. And also then it sets up a lot of fear for, well, is it going to happen again, basically? So this is not an exhaustive list. And again, it's not necessarily in order of you know, significance, but I just wanted to sort of bring some ideas, really. So probably one of the most significant risk factors is if you have already had an ectopic pregnancy. So we know that if you've already had one, your risk of having a further ectopic increases by around 10%. And in some of the literature, it's a little bit higher than that, so up to 20%. So the key message really is to, if you have had an ectopic and you get pregnant again, is to go and see your doctor, you know, as soon as possible, and alert them to the fact that you are at higher risk of having a second one. And that actually they will then, you know, refer you for an early scan just to make sure that everything is in the right place and where it should be. Age is also something that places you at higher risk. Unfortunately, there's nothing we can do about that. So one study was showing that the age, the risk for women at around 21 years of maternal age was about 1.4%, whereas the risk for women who are sort of over 44 was 6.9%. So actually quite a significant difference, really. Fortunately, it's not, you know, in terms of age, that's something that we can't sort of change, but there are lots of things that we can do, and I'll go on to that in a minute. Smoking. Now, I'm sure that you know, the vast majority of people that are obviously trying for a baby, you know, are certainly not smoking at the moment and will have given up smoking a while ago, you know, in preparation. Obviously, if you are still having, if you do still smoke, or you are still having the odd cigarette here and there, it is really important for a number of reasons with fertility to stop smoking. But in terms of ectopic pregnancy, the smoking basically alters the lining of the inside of the fallopian tube. So if you imagine the tube itself, on either side is lined with little sort of finger-like projections called cilia, which is like sort of little hair-like projections. And they basically move along in waves at a certain speed and a certain sort of contractions. And anything that affects that movement basically will affect the movement of that egg, and then if it's fertilized, the embryo into the right place. So anything that can sort of slow down that movement obviously allows more time for the embryo to implant in the fallopian tube. So we definitely know that smoking is one of those factors that can actually impede that movement. And very interestingly, even for women who have smoked in the past, your risk of ectopic pregnancy is higher than those women who have never smoked before. So we know that one study was showing that the risk of a woman who has smoked only returns to that of a non-smoker after at least 10 years of quitting smoking. So, you know, just think back to, you know, what we're perhaps doing in our sort of teens and early 20s and things, you know, those sorts of things can come back and be problematic even when you're sort of trying a few years later. So moving on to tubal pathogens, so the sort of the bugs that live in our fallopian tubes. And this is something that we're going to come back to, you know, again, on a few occasions in this presentation, because actually this is an area that is becoming increasingly important within the sort of the ectopic research community. And what we're looking at is things like common sort of sexually transmitted infections, so things like chlamydia, gonorrhea, other bacteria called like mycoplasma. These are often associated with a condition called pelvic inflammatory disease, which for most women may be completely asymptomatic. So you may not have any idea that this may be an issue for you until you start having problems with your fertility. Other sort of bacteria, so things like mycoplasma and ureaplasma, are often associated with something called bacterial vaginosis, which is like an overgrowth of bacteria in the vagina, and this has been associated with tubal factor infertility. So basically the main umbrella term of problems with the tubes causing infertility. So as I said, we're going to come back to this again later on, but just to sort of finish off the risk factors, the hormonal influence is an interesting one as well. So women who have got pregnant sort of accidentally whilst using an IUD, so which is a progesterone-based device that gets sort of inserted and left into the uterus, women who use the mini pill, which is a progesterone-only pill, and women who get pregnant despite using emergency contraception, of which one of those is a progesterone only. So these obviously are effective forms of contraception, but in the sort of the cases of failure of those methods, you are at higher risk of having an ectopic pregnancy. And the reason for that, again, is looking back at this, the ciliary function, so the little hairs that line the inside of the tube, the sort of the progesterone from these types of contraception can really reduce the number of cilia that are there, and also the frequency in which they move. So that's going to have an impact. And then going on to IVF as well. Now, this is something that I'm not sure is that, you know, commonly known, is that actually your risk of having an ectopic pregnancy is higher when you have IVF compared to natural conception. And so the normal risk for ectopic pregnancy is about 1%, so sort of 1 to 2% in the population. But for IVF, the risk goes up to around 4%, so a sort of a doubling. And we know that the rate of, or rather the risk of ectopic pregnancy is higher with a fresh cycle compared to a frozen embryo transfer. The reason for that is obviously there's a lot more sort of drug and hormonal influence in a fresh cycle, particularly in the first half of the cycle, in order to sort of stimulate the follicles and to get enough eggs to, you know, for collection. So what can happen is that the estrogen that is used for the first half to stimulate the eggs actually causes the uterus to contract more frequently than it would do normally. And what can happen is, unfortunately, the embryo, which obviously when they transfer the embryo, they're bypassing the tubes, but this estrogen influence can cause extra movement in the uterus, which means that unfortunately the embryo has this retrograde movement. So it moves from the uterus back up into the opening of the fallopian tubes. And unfortunately, some women do suffer from ectopic pregnancy out after having an IVF cycle. So I think, you know, that's, you know, quite an important experience to understand, and we'll go on a little bit to talk about, you know, what you can do to lower your risk. And just finally, anybody who's had any sort of pelvic surgery, there is more risk of having sort of scarring or sort of adhesions in the pelvic area. Obviously, that could possibly impact on the fallopian tubes. Okay, so what can we actually do to reduce our risk? And as I said before, I think it's just very, very important to keep stressing the fact that if you've already had one, you are at higher risk of having another one. So you must go and see your GP when you do get a positive pregnancy test. But it's also just important to remember that your risk is also associated with why you had an ectopic in the first place. So, for example, if you had damage to a tube and then your tube was removed and the other tube is obviously very healthy, your risk of having a second ectopic is probably fairly low. If you had damage to your tube, but your tube was left in place, then, you know, you're probably going to be at the same risk as you were. Now, there are definitely things that you can do to reduce your risk, but I think it's just important to sort of think about this on a very individual level. So really the main lifestyle factors are, as I said, if you are a smoker, then that really must stop. Trying to, you know, for possibly for younger women in this case, trying to limit the number of sexual partners and the number of unprotected sex, you know, the amount of unprotected sex that you may be having in terms of how much exposure you might be having to, you know, potential pathogens that might sort of cause these ascending infections. That probably doesn't apply to most of the women listening today in terms of sort of, you know, trying to have a baby. But it's just, you know, sort of looking back on perhaps, you know, a previous sort of a different time in your life that maybe that might have contributed slightly. In terms of the hormonally driven conditions, we know that, as I said, with the IVF, it's worth speaking to your clinic and just talking about the risk of a fresh cycle versus the frozen embryo cycle, and just sort of seeing what your clinic sort of gives, what advice they give you on that. The research is definitely showing that women are at a higher risk of an ectopic pregnancy with a fresh cycle, which we've discussed before. Things like endometriosis, which is hormonally, certainly has a hormonal influence. It's also an inflammatory condition, and we're going to talk about that in a little bit as well. But women with endometriosis have double the risk of ectopic pregnancy, and that is due to increased inflammation in the pelvis area with adhesions and sort of scarring and lesions as well. And often this can impact the movement, again, the way that the function of the fallopian tube. And I'm going to cover endometriosis, but I think it's important to sort of really think about how well you can manage these sorts of conditions. We also know that with PCOS, which is obviously a different hormonal condition where women have increased testosterone levels, that can also affect the movement of the tubes as well, and slow things down, sort of putting women at higher risk. So I think the concept really here is to try and manage some of these conditions to reduce the amount of inflammation, and to really balance some of those hormones to try and sort of reduce the risk of ectopic pregnancy. Now, moving on to vaginal health, and this is an area that is very, very exciting in the fertility community, particularly at the moment. There's a lot of research coming out, and we know that the ecology, so the what we call the microbiome, which is like the ecosystem of bacteria and other sort of microorganisms that live in the vagina, basically are incredibly important when it comes to the health of a pregnancy. And we know that certain pathogens, so things like, as I said, chlamydia and gonorrhea, and some of the other more common bacteria that live in the vagina that may sort of go into, have an overgrowth of those bacteria, that can actually cause problems with tubal pathology and also with the function of the tube as well. So we really want to support, we want to get rid of anything that shouldn't be there in terms of sort of pathogens and bugs and things. And we also want to support a really healthy vagina. That is very, very important when it comes to sort of having an environment in which, the pregnancy is going to be as successful as possible. And then finally, in terms of reducing our risk, we want to really think about reducing inflammation. And a lot of these conditions, as we talked about, sort of endometriosis and pelvic inflammatory disease, general sort of, after surgery and things, often there can be a lot of inflammation that can cause, changes to the pathology, or rather the smooth running of the tube. If there are things that we can do to actually reduce the amount of inflammation, that certainly can help matters. So let's just go through exactly what we can do to improve our chances of having a successful pregnancy. So I think that the good news, and I want to sort of stress that there is a lot of good news with life after an ectopic, is that actually, really the majority of women will go on to have a healthy pregnancy. And they think that about 65% of women will go on to have a healthy pregnancy within 18 months of trying after having an ectopic. And amazingly, this also goes up to about 85% in sort of 2 years after trying, starting to try after an ectopic. So I think we've sort of got to hang on to that, really, that actually, although it can be an incredibly devastating experience, that, that really most women will go on to be able to have a family. So what do we actually, what do we actually need to do in order to improve our chances? And the first thing, again, I'm coming back to this again, but I just want to sort of get this point across, that most women with tubal factor infertility, and what that actually means is it's sort of this umbrella term to anything that causes some sort of problem with the movement of the egg or the fertilized egg through the fallopian tube. So that could be caused by some a disease or an obstruction or damage or scarring, or, there are many other factors, but essentially this sort of umbrella term. But most women with tubal factor infertility do not actually have a history of pelvic inflammatory disease. So but rather what they have is this sort of asymptomatic upper genital tract infection. And I think that's really important to remember, is that a lot of women have no clue. They've got no sign that actually there's anything that may be problematic. And it's really, then it comes as a big shock that the first thing that they know is either they start having problems conceiving or they have an ectopic pregnancy. And it really sort of feels like it comes out of the blue. And I wanted to really highlight this one study, which looked at a group of 245 women undergoing a hycosis, so where they sort of having their tubes checked just for routine infertility screening. And these were the levels of these particular bacteria that we talked about, that they were finding just routinely. And the results were showing that actually bacterial vaginosis, which is this overgrowth of bacteria in the vagina, is more prevalent in women with infertility. And also that colonization of particularly of ureaplasma and mycoplasma is associated with tubal factor infertility in asymptomatic infertile women. So the point is here is that actually you may not think that there is an issue, but it's really important to actually find out whether you have any of these bacteria, and then we can deal with it basically. And, and as soon as possible, because the longer that these things sort of go on, that's when inflammation starts to build up, really. So the main sort of one of the main ways, and this is why I'm saying this is a really exciting new area in the sort of the fertility field at the moment, is that actually there is a test that we can do. So in terms of things like chlamydia and gonorrhea, it's important to go to your your local sexual health clinic, or you know, go and speak to your GP, and you can get all of that done via your GP or via your local sexual health clinic, and just get that ruled out, whether you have a sort of a previous infection or something sort of going on that you're not sure about. In terms of actually looking at the health of your the sort of the healthy bacteria in your vagina, have you got enough of them? Are there any bugs in there that shouldn't be in there that are causing problems? There is a fantastic new vaginal microbiome test now that you know, for us in the fertility community, we're getting very excited about this. And for me, I have just been blown away by the research, really. And I'm now using this with all of my clients, because I just feel that this is such an important area, particularly for you know, for women who have had an ectopic pregnancy, but also for those of you who have had miscarriage or just general problems with conceiving. You know, we want to know what's going on down there. So this is not the standard test that you're getting from your GP. This is something different. This is looking at the healthy bacteria as well. And the important thing to know is that actually the vaginal tract is host to over 200 species of microorganisms. It's a very complex ecosystem, and problems with this this ecosystem is something called vaginal dysbiosis, where you might get overgrowth of not so friendly bacteria, you know, things going on down there that you know, is causing disruption. And we know that that's been linked to problems with infertility, with bacterial vaginosis, which we talked about, tubal factor infertility, and even preterm births, miscarriages, and you know, increased risk of sexually transmitted infections, just simply because you haven't got the full protective you know, environment within the vagina. It is really essential to support, not only to remove the pathogens, so the bugs that shouldn't be there, but also to support the friendly bacteria that we want to really, you know, create a very happy, healthy environment down there. Okay, so I think that's, you know, in terms of let's really just find out what's going on, so then we can support it as best as possible. Okay, so the next thing, again, it sort of comes back again to this sort of inflammatory condition. So really investigate and treat any pelvic inflammatory disease. So as I've mentioned, a lot of women are completely asymptomatic. So what is it? It's an ascending infection of the reproductive organs. So usually it's a sexually transmitted bacteria that spreads from the vagina up into the uterus, the fallopian tubes, or the ovaries. Symptoms can vary. It can be very mild. As I said, a lot of women have no symptoms at all. And really the first sign can be problems with infertility. If you do have symptoms, they might be things like, you know, pain, which can be from mild to severe in the sort of the lower abdomen and the pelvis. You may get an abnormal sort of vaginal discharge that may have a sort of an unpleasant smell. You might get sort of abnormal uterine bleeding, especially sort of during or after intercourse or between periods. Possibly pain during intercourse. Occasionally you might get a fever. Sometimes it can just be sort of painful or sort of unusual changes to your sort of going for a wee, basically. So, you know, there are lots of, it can be quite a vague sort of range of symptoms. So I think the idea is that really, if you have got any of those symptoms, definitely go and get yourself checked out. And if you haven't, but you are struggling with conceiving, I think it's definitely worth just ruling out some of these things. So in terms of the causes, we go back to the same sort of bacteria are cropping up again and again. So things like chlamydia, gonorrhea, mycoplasma, and other bacteria that normally inhabit the vagina, that are sort of, the vagina's lost that sort of protective ecosystem for a number of reasons, and some of these bacteria are actually sort of growing, you know, are sort of overgrowing and causing problems. Treatment is a course of antibiotics for pelvic inflammatory disease if you have got an active infection, usually a sort of a 14-day course, and it's really important to remember that you can have cross-contamination with your partner. So your partner would need to be sort of treated and checked as well. So I think that can be a problem, is that you can get sort of reinfections within partners who are essentially just sort of reinfecting each other. because they're unaware that they even have the infection in the first place. But at the same time, that is causing sort of inflammation and problems internally. So important to really get that checked out. And then sort of consequences, unfortunately, can be, so the consequences of pelvic inflammatory disease are sort of scarring, narrowing of the fallopian tubes. So, you know, in some cases, you can even get abscesses in that area, permanent damage and things. So really important to check. And then just sort of moving on, I'm sorry, I'm just aware of time, but I'm just wanted to mention endometriosis in terms of this is an inflammatory condition, and probably a number of you may have endometriosis. It's very common in women who are struggling to conceive. They think that about 10% of women of reproductive age have endometriosis, and actually 40% of women with infertility have this condition. So very important to be aware of this. It's where essentially the cells of the lining of the womb actually migrate outside of the uterus and grow in other parts of the body. So this can be around that area, so the fallopian tubes, the ovaries, the bowel, the bladder, and occasionally they can migrate to further places like the lungs, but that's fairly rare. The main issue for ectopic pregnancy is it causes increased inflammation in this area, and can lead to sort of scarring and adhesions and just general sort of problems in that area. And unfortunately, it can take years to get a diagnosis. I think the average is about 7.5 years. The reason for that is it really can only be definitively diagnosed with keyhole surgery. And obviously that is done under a GA. So it's you know, to really get in there and have a look, it's not enough just to have a scan. They can get some idea, but to get that definitive diagnosis, you need to actually sort of be in there with a scope, basically. So in terms of you know, so just some symptoms can be sort of chronic pelvic pain, painful periods, again, pain during intercourse, digestive symptoms, so sort of constipation, bloating, pain, those sorts of things, bladder pain as well, or it could just be a general fatigue, or again, it can just be infertility. So it's really important, if you are struggling with your infertility, that there are a number of things to really sort of investigate and just make sure that you are not, you know, that this may not be a contributing factor. We know that in endometriosis, inflammation is a major driver, so we need to reduce inflammation. We know that gut health is associated. So just as there is a microbiome in the vagina, there's also a very extensive microbiome in the gut. Problems with that can cause, can impact on your reproductive system, and you know, there are links between poor gut health and endometriosis. And also sort of changes in the immune system. So basically, we want to reduce inflammation, we want to support gut health, we want to support hormone balance, and we want to reduce stress. They're the, you know, some of the key things that you can do to manage endometriosis. Obviously, you do need to sort of see your GP and have that conversation with them as well. Okay. So just sort of quickly moving on to, well, what can you actually do to, we've talked a lot about reducing inflammation. What can you actually do? And there is a lot you can do in terms of eating an anti-inflammatory diet. And this is a really lovely diagram of how, you know, the basics of how to eat an anti-inflammatory diet. So sort of a Mediterranean diet. And we know that inflammation is often involved in ectopic pregnancy. So reducing this inflammation can help with that. But it also helps with all aspects of our fertility, from supporting egg and sperm health, and also supporting that uterine environment as well. So, and the vaginal microbiome as well. So it, you know, it's really covers so many different bases, eating like this. So lots and lots of colorful fruits and vegetables, about half of your plate, whole grains. So swapping your fluffy white refined carbs for whole grains that's got lots of fiber in it. Fresh herbs and spices, healthy fats, so oily fish so twice a week, avocados, you know, nuts and seeds, those sorts of things can be really helpful for fertility as well. And then making sure that you're having enough protein. So, you know, a quarter of your plate needs to be made up of protein. So as I said, oily fish, so maximum sort of twice a week, but white meats, eggs, nuts and seeds, plant proteins like beans and pulses, and just keeping your red meat down to a minimum, because in some women that can be inflammatory. So the four pillars of eating in this way, as I said, is just thinking about eating the rainbow, thinking about where's my protein. Often it's quite easy to forget protein and just sort of eat a sort of carbohydrate heavy meal, but really thinking about, have I got some protein on my plate? Having plenty of healthy fats, which is really going to support, you know, your every cell in your body needs fats for the lining, the outer boundary of the cell needs fat basically, and it's great for hormone health as well. And then finally, reducing or trying to avoid as much sugar as possible, so swapping for lovely whole grains and lots of fiber. Okay, and then just as a last last section, I wanted just to sort of talk about, you know, how you can move on after an ectopic pregnancy. And this is really something that I get asked a lot. And this is really because there is a great amount of fear after an ectopic, and women are very fearful of, is it going to happen again? They often feel, as I said, very traumatized, especially if they've had to have, you know, surgery, or if it's been a very long, sort of drawn out, you know, having to go back to the hospital time and time again. You know, it can be very difficult to sort of come to terms with that and really move on. And I think that for me, this is very much how I felt after my first ectopic. I felt lost, I felt incredibly frightened, and I just felt like hopeless, really, that, you know, I wouldn't be able to have a baby, and if I did, that it wasn't going to happen again like this. So when I did actually end up having a second ectopic, which was a few years later, I just really decided that I was going to do things very differently. I couldn't go through that sense of just being so lost and grieving, and it took me a long time to get over that first one. And obviously the second one was very distressing. I was better prepared for it. I think the shock of the first one had been so overwhelming. When you've already had one, you sort of gearing yourself up, is it going to happen again? But I just decided to do things very differently, and I was very proactive about how, you know, the things that I did to try and move me forward. And this is something that I sort of talk about a lot with the women I work with and the women I support in my Facebook group as well. And I just want to sort of go through just a few of the steps, but just to say that I have actually written an interactive workbook that covers all of this in detail. So it's completely free. You're very welcome to download that if you're struggling with this. But the idea really is to be kind to yourself and to take it one day at a time. And I think it's very, very important to actually take some time to say goodbye. You know, you've been through a massive loss. I think it's very important, rather than just constantly sort of trying to move on to the next thing too quickly, is to actually honor the fact that you have lost a baby. For me, I used, you know, we planted a rose bush in the garden, just something very simple, but something very beautiful that I can see. And every year when it flowers, it just, you know, it just reminds me of something that, you know, that was very important to me. Other women, you know, may just sort of light a candle and just say a few words. I know that some women are writing letters, some women even sort of getting tattoos, some women are, you know, buying a sort of special piece of jewelry. There's just something to mark the passing of that baby. Journaling is very important as well. If you can, just sort of getting, it doesn't matter what you write, it's just getting some of those, the jumble of thoughts out of your head onto paper, and that can be really helpful. And then trying to start reconnecting with your body. And a lot of this, I sort of use sort of positive affirmations, just trying to rebuild trust with your body again, forgiving yourself. Obviously, it's not your fault, but there can be a real sense that you can start blaming yourself. I certainly did. You know, what had I done to have caused this? Why me? All those sorts of things. And that can be very, you know, it can be a very difficult relationship to rebuild with yourself again. And then finally, it's this idea of actually trying to do something every day that brings you a sense of joy. And I think it can be very easy to just get sucked into the grief of having been through that experience, and actually what you can do to just remind yourself of something. It can be the smallest thing in the world, as simple as sitting in the garden and having a cup of tea, or going for a walk, or just something. Obviously, everyone's going to be individual. You're going to have your own things that make you happy. But just even doing something just for a few minutes every day can be really, really important, and start building a sense of moving forward. So that's it really. That's really what I wanted to talk about, and just bring some of these areas, you know, really try and sort of think about some of these areas with you today. So we're going to, I don't know if anybody has got any questions. I'm very happy to answer them today, or if you think of something afterwards, you can always email me afterwards, and we can sort of go from there. But these are just the ways that you can connect with me. As I said, I do have this free sort of interactive workbook that really goes into far more detail about what you can do if you're struggling to move on. I run a closed Facebook group to support women who are at the point of trying to, you know, they're ready to start trying to conceive after having an ectopic pregnancy. And then obviously I work one-to-one with clients to really help move them forward. And I do have I have offered for people that are listening to this webinar, if you're interested and you want to know more, just email me, and I'm offering a 10% discount for anyone who, you know, before Christmas basically. So got a little while for those of you who are watching the replay as well. So please get in touch, and we can go from there. And just as a final point, I'm very excited to say that I will be, I'm planning to run an online group program for women who have had an ectopic in the new year. So sort of watch this space really. So anyway, I hope that was useful, and just see if there are any questions now.
Thank you so much, Victoria. That was so comprehensive. I learned a lot. Thank you very much. What we can do is, we don't have heaps of time, but if anyone has got any questions, then you can either unmute yourself, or you can pop the question in the chat box and I can ask it for you, and whatever you choose. Or else, as Victoria said, drop her a note and get in touch with her. Her email is up there, and then she can answer any questions after the event as well. So we'll hold off and see if anyone's got any questions. Here we go. From Hayley: is the vaginal microbiome test available on the NHS as a standard?
No, it's not. That's what I was saying, is that obviously there are some tests that you can get done to check for pathogens, so the you know, infections and things with the GP. The vaginal microbiome test is a private test that we're running through a lab company called In Vivo. It's an absolutely fantastic test, but that isn't available on the NHS. So if you're interested in that, just get in touch, and I can talk you through that, about how that works.
Great, thank you. That's really helpful. Okay, we'll hold off and see if there's any more. But yeah, I would say I highly recommend Victoria. I've actually worked with her before, and she's amazing to work with. So if you're interested in that 12-week program, then yeah, do give her, drop her an email and get some more details, because it's a great program to work through, and good to have that discount. Thanks for offering that, Victoria.
You're welcome. Thank you.
Great. Don't think there are any more questions coming through. Really, really fascinating stuff. I think this is going to be a really, really great playback for people as well. So much helpful information. So thank you for sharing so much.
You're very welcome. Well, thank you for having me today, and thank you for everybody for coming. I'm sorry about the technical hitch at the beginning. I hope that all sorted itself out. But I really do hope that you've sort of got some ideas, and I wish you all well on your journey forwards.